Gabrielle Richard. I'm a nurse practitioner student at Montana State University. And you're Hallie Richard?
Yes.
Great. And your birthday?
June 6, 2005.
Okay, thank you. And Hallie, do I have your permission today to record this assessment for the purposes of learning? My classmates and instructor will review this and it won't be replicated for any other purposes?
Yes.
Okay, thank you. And I'm just going to begin by washing my hands here before we get started. Okay, and then Hallie, will you need to use the restroom at all before we do today's assessment?
No, I'll be good.
Okay, great. So I understand that you're here today with a chief complaint of some pain in your abdomen. Can you tell me more about that?
Yeah, it's kind of like my upper right side,
Okay.
and it happens when I'm eating like fast foods or like cheeseburgers, stuff like that.
Okay.
It's been happening like for 2 weeks now,
And when it happens, what would you say the pain severity is on a scale of 1 to 10?
7 or 8.
Okay. And you said kind of sharp shooting pain?
Mm-hmm.
Okay. And how long does it last for?
Like 5 to 10 minutes.
Okay. And then has anything helped reduce the pain when it does happen?
Yeah, heating pad helps a little bit, and I've taken Tylenol and ibuprofen. It helps a little bit.
Okay, great. Has anything like this ever happened to you before?
No.
Okay. Do you have any history of high blood pressure, diabetes, or heart conditions?
No.
Okay. Have you noticed any other GI symptoms like acid reflux, nausea, vomiting, diarrhea, constipation, or any changes in bowel movement?
No.
Okay. Any changes in appetite?
No.
Okay. Any urinary symptoms like pain with urination or urgency or frequency?
No.
Okay. No lower back pain?
Not lower. I can sometimes feel it in my upper back.
Okay.
When that happens.
All right. Well, for today's assessment, Hallie, we're going to do an abdominal assessment, but I also need to do a hair, skin, and nail exam. So we'll begin with that, and then we'll move into the more focused abdominal exam.
Okay.
Okay, so if I could have you stand for me. So right now, I'm just going to kind of be looking, I'm going to move your hair here just for the camera. So I'm just looking for areas of redness or erythema, it's called. And go ahead and turn around for me. Okay, good. I'm not noticing any areas of redness. Go ahead and turn back to the front. Your skin tone looks evenly distributed. No areas of discoloration. I'm not seeing any areas of blueness or purpleness, which would indicate potential issues with circulation or blood flow issues. I'm also not noticing any yellowing of your skin tone, which could indicate dysfunction with your liver with increased bilirubin levels. And then I'm also not noticing any hypopigmentation or hyperpigmented areas. I'm not seeing any lesions or anything. Do you have any cuts or scrapes, bruises, anything that you're aware of?
No.
Okay, go ahead and turn around one more time. Just looking here again for any bruises or lesions, scarring. Okay, go ahead and turn back around. One other thing we look for, Hallie, is called nevi, and that's another term for a mole. So I'm just going to document this one here. Has that always been normal for you?
Yeah, it's never changed.
Okay, and I'm noticing regular borders there, about 2 millimeters in diameter and width. And then with mole changes, we always just let people know to kind of use the ABCDE method to monitor over time for any changes, which could indicate a risk of skin cancer. So you want to look for things like asymmetry, irregular borders, color changes in a mole, increased diameter or size fluctuations, and evolution would be changes over time. So you can go ahead and sit down. And if I could have you take your socks and shoes off for me too, we're going to take a look at your toes. So I'm going to take a look at your nail beds and just kind of check the color and the shape of your nails here. Okay, color looks good. Capillary refill is good. And I'm also going to feel with the back of my hands here for the temperature of your skin. Okay, Nails look good. Capillary refill's good. Okay, go ahead and place both feet on the ground there. I'm also feeling the temperature of your skin just up from the front, and then there you go, and turn over. Good. Feeling all the way up here on the trunk. Okay. And then I'm also going to look at these nail beds here. I'm not noticing any clubbing or curvature. I do see some vertical ridges, which are normal. Check the capillary refill there, which indicates good circulation. Let's see here. And if I could have you stand one more time. Thank you. I'm just going to also feel the temperature just of your back side here with the backs of my hands. And that temperature is even. Not noticing any clamminess at all. You haven't had any fevers or anything recently, have you?
No.
Okay. You can go ahead and sit back down. So I would say your skin moisture was normal and dry. Texture overall of your skin is smooth, soft appearance. Your pore sizes are normal. Good glow in the light reflection there. There's one other thing here, Hallie. I just want to borrow a hand. So I'm going to pinch your skin and see how quickly it goes back to normal. And up here also. Okay, good. And that's a normal rebound time. So this kind of indicates your hydration status. So that all looks good. And then one other thing, Hallie, I'm going to look here just kind of at your hair distribution. Excuse my reach there. So I'm just kind of looking at how your hair is distributed right now. It looks very even, has a nice wave to it. I do see some nice color highlights there. You're naturally brunette?
Yes.
Okay. And your hair's always been kind of thick and wavy?
Yep.
Okay. I'm just going to kind of part here and look at the scalps, make sure there's no lesions. You haven't had any head injuries at all, have you?
No.
Okay. Okay. Good. All right. Looks good. And now we can move on to the abdominal assessment. Okay, Hallie, so I did just wash my hands again. We're moving on to the abdominal assessment. So how this is going to work is I'm going to have you lay down on the exam table. I'm going to kind of inspect your abdomen, and then I'm going to listen to your bowel sounds, listen to your stomach, make sure everything sounds normal. And then I'm going to do some light percussion. And that's just to listen to the underlying structures, make sure everything sounds like it should and is in alignment. And then we're going to move forward with some palpation where I kind of feel the structures a little bit deeper, but we'll save that liver area for last since that's your area of pain.
Okay.
So if you just want to lay down here for me on the exam table. All right, so to begin, what I'm looking for here in the abdomen is symmetry. So I'm seeing that everything looks symmetrical. I'm not seeing, it's flat, no bulges or protuberances, no concavity where it's like elevated or scaphoid where it's inverted at all. And then the skin, again, there's no scars or rashes, lesions. I'm not seeing any veins or redness or bruising, no rashes present. Your umbilicus or your belly button is midline and inverted. There's no inflammation that I'm seeing, no hernias. And then your epigastric area just above your abdomen. I'm not noticing any aortic pulsations. That's the big blood vessel that runs through your abdomen up to your brain. So that all looks normal to me. So I'm going to come over to the other side here of the exam table. And then I'm going to start with just listening to your abdomen here. So I'm going to listen with the diaphragm here and just listen to the bowel sounds in the different quadrants. Okay. Okay, so that all sounds good. And then next I'm going to listen for what's called friction rubs, and that would indicate anything kind of abnormal tissue swelling, if I hear any grating. And I'm going to listen over your liver and spleen areas and that might indicate some inflammation in your abdomen. So just go ahead and take a few deep breaths for me. Okay. And one more. Okay, good. And I didn't hear any rubbing there, so that's good. And then next I'm going to listen with the bell, the smaller part of my stethoscope here, and listen to the blood flow for any what's called bruits that could indicate turbulent blood flow. But you said you don't have any issues with like high blood pressure or atherosclerotic diseases, anything like that?
No.
Okay, so just breathe normal for me on this one. Okay, and I'm moving it out sideways here a little bit, laterally, to listen to the renal arteries coming off of that aorta. And then I'm coming out laterally here, a little bit lower, to listen to those iliac arteries as well. Okay, so that all sounds good. And then I'm also listening for any venous sounds, any hums. Those are like low-pitched sounds over the inferior vena cava, which could indicate turbulent blood flow as well. So I'm just gonna listen one more time with the bell here. Okay, and that all sounds normal. Next, Tally, we're gonna move on to percussion. So I'm just going to tap on the different areas here. So your epigastric, your umbilical area, and hypogastric. Okay, so those all sound like tympanic sounds, so that indicates to me that the structures underneath are normal. There is a couple tests here that I'm going to percuss down and out to listen for a change from tympany to dullness, and on the outer sides here, so it kind of shifts from this tympanic sound to a dull sound on the outer edge, which is what should happen. I'm just kind of percussing in an outer stellate pattern here. Okay, and then this one is called a fluid wave test. So I'm going to tap on this outer side here and see if I feel any fluid come over to this side, which could indicate excess fluid called ascites in your abdomen. So I'm just going to tap here. Okay, and then go ahead and turn towards me just a little bit. So I didn't feel a wave at all. I'm going to do it one more time, just this direction. Okay, and I did not feel anything abnormal there. Next, I'm going to assess your spleen area with percussion, just to see if you could potentially have an enlarged spleen at all. I don't suspect that since you don't have any symptoms on that side, but anyhow, we're just going to do some percussion from the lateral edge here of the costal margin. Okay, and that is all sounding like it should, that tympany sound again, which is normal, so that doesn't indicate to me any concerns for an enlarged spleen. I'm going to do it one more time and just take a deep breath. Okay, and that sound remained tympanic, so I don't have any concerns again for splenomegaly or an enlarged spleen. So next we're going to move on to palpation. So I'm just kind of going to gently feel around the structures of your abdomen here with light palpation. Any pain at all?
Just a little tiny bit
On the upper right? Okay. And so when we go a little bit deeper, I'll save that for last. And then let's see here. So I do want to check for any rebound tenderness. Let's see. So this could indicate symptoms of peritonitis, so just let me know if any pain when I press down and let go on that area. Okay, that area. And then on this side. Okay, good. And then I didn't feel any masses or anything, so that's good. I do want to do a couple tests while we're here for potential appendicitis, which is in your lower left abdomen here. Okay, so I'm going to press slowly and gently on your left lower quadrant here. This is called a Rob sign test. I'm going to quickly let go and let me know if you have any pain in this lower abdomen on the right side. Okay, good. Next, I'm gonna do what's called a psoas sign test. So just try to lift your right leg here against some resistance. Any pain in your lower right abdomen with that? Okay, good. And then this last one here is called the obturator sign. So if you could flex your knee up to your chest here, good. And then we're going to internally rotate that hip. Do you have any pain with that movement at all? Okay, good. So that is all of those tests indicate negative appendicitis issues. So I don't suspect any issues with your appendix at this time. I am going to move over to the opposite side here as I palpate your spleen on your left side. So I'm going to place my left hand just under your back here, and then let's see, so I'm going to feel and go ahead, yep, just arms at your sides. Okay, and then let's see, I'm going to feel just below your costal margin here and feeling for your spleen. It shouldn't be palpable, and then do take a deep breath, and then I'm just gonna press a little bit deeper and try to feel for your spleen. Okay, and that is not palpable, so that is normal to me. I'm gonna come back to the other side of the table, and I'm going to feel just your aorta. So that is just slightly right of the midline there. Okay, and I feel that. And then I don't feel any aortic pulsations. I am going to kind of measure the width of your aorta here. Okay, and that is less than 3 centimeters, which feels normal to me. That's about what it should be. I'm also going to do your kidney on this side. So, I'm gonna do your kidney on both sides. So let's see, I'm putting my left hand underneath, and then I'm placing my right hand on top, just parallel to the 12th rib here. And then take a deep breath, and then I'm going to just see if I can feel that kidney at all, and I don't, so that's good. I'm gonna do the same thing on this side, and go ahead and exhale. Okay, and those kidneys aren't palpable, so that's good. Can I have you sit up for me for this next test? I'm going to feel the and actually scoot forward just a little bit for the camera. Sorry, this direction. There you go. Okay, and what I'm going to assess now is for any costovertebral angle tenderness, which would be common in an upper kidney infection, in what's called pyelonephritis. So I'm just making a fist here, and I'm going to strike along the costovertebral angle. Do you have any pain with that at all?
No.
Okay. How about that side? No? Okay. And you can go ahead and lay back down. Okay, and next we're going to assess that liver. So let's see here. I'm going to place my hand under your back again here and lift up, yep, and go ahead and relax. Okay, and then breathe deeply, and I'm going to, well actually, you know what, first I'm going to just kind of estimate the width of your liver. So I'm going to palpate or percuss here until I hear dullness. Okay, so about right there. Can I have you put your finger right there for me? Good. And this is just along the mid-clavicular line here. So I'm just measuring the estimated length of that liver. Okay, so, and with my measuring tape, I would see that that's approximately 6 centimeters or so, or excuse me, inches. And that's normal, so that's good. And then from that mid-clavicular line too, I'm going to, okay, so about 6 by 3. Okay, so now we're going to palpate that liver. So go ahead and take a deep breath in for me. I'm just trying to feel that liver edge and exhale. Any pain with light palpation? Okay, I'm gonna press a little bit deeper on this one. Deep breath in. Okay, and exhale. And I'm just kind of using the hooking method here to grasp the edge of that liver. Okay, so I do feel that. Do you have tenderness with that?
A little bit.
A little bit? Okay, good. That would be a positive Murphy's sign, Hallie. You can go ahead and sit up. So I just want to talk to you a little bit about that. So I do have a slight concern with your symptoms for what's called cholecystitis, which is a possible inflammation of the gallbladder. So the gallbladder releases bile. That's helpful in digestion and certain functions. So if that cystic duct blocks, it does prevent draining from the gallbladder, which can sometimes cause a sharp pain, especially after eating like high-fat foods and stuff like that, as you were describing. So what I'd like to do is check for the possibility of having gallstones. I'd like to order an abdominal ultrasound just so we can get an image of that structure and see if we see any blockages or gallstones present. Depending on the results of that abdominal ultrasound, I may be able to prescribe you a medication like uricidol, which can help slowly dissolve gallstones over time if they're fairly small. Or there is a potential that a surgery could be indicated for what's called a cholecystectomy, in which they would actually remove your gallbladder. So we'll start with that abdominal ultrasound from here and see what those results are, okay?
Okay.
All right.
Thank you.
You're welcome.